Thank you so much. Looks like I am now on video. So great to meet you all. Some of you I've talked to before, or I may have talked to you before. Really great to have to really have an opportunity for you all to ask questions and get some more information about Health Tech Academy, what we're here to do, and why we are here to do it. So my name is Suzanne Shaw. I'm one of the leads here on the advisory board for Health Tech Academy. I've been working in education and healthcare for over 10-15 years, and really excited about what Health Tech Academy is here to do. So we're really focused on transforming and innovating the way healthcare professionals are educated, hired, and trained. And we're committed to solving healthcare's staffing challenges. We'll be partnering with major universities, employers, educations to help impact those emerging roles through apprenticeships and learning pathways. Something that's really important to note is in the healthcare field, there is a shortage across the nation and almost all allied health roles. And when we talk about allied health, let's talk a little bit about what that means and why Health Tech Academy is here. So what we are not, I always like to kind of start. We're not a nursing school. We're not talking about physicians or dentists. We're really, truly talking about the healthcare team that's on the front line, and that's what we call our allied health. So allied health professions are, think about those positions, those support positions in patient care. So what's really important about all these roles, physical therapists, dental hygienists, dental assistants, rad techs, medical assistants, patient care technicians, really anything that has that technician assistant means that you are here to support the experience for every patient. I'm sure many of you have been to a dentist, or many of you have been to if not all of you have been to a doctor at some point. And that first person that you see and that you're interacting with is going to typically be the front desk receptionist and then the medical assistant. And they're the ones that truly deliver that patient care experience from the beginning to the end. And we are committed to building students building the confidence and skills and competencies of our students so that not only do you feel confident as a professional in allied health, but that you are delivering quality patient care and taking into account the impact that you're making in people's lives. I'm going to go a little bit more in depth about our programs, but before I get to do that, I just want to kind of set some expectations. If you're not able to ping in the chat, totally fine. There is a Q&A in the Zoom link, so please feel free to use the Q&A tab. Shamsah is here to help support, so if there's any questions, she can ping me. I'll also be watching, so keep that in mind. I would love to hear questions that you have, whether that be about the programs, specifically on the professions that we're going to be talking about, or what the student experience is like, what our mentors and coaches mean, things like that. So we're going to go into the nitty-gritty, but please, if you have any questions, do not hesitate to ask. Well, we're going to get started. So I'm going to go over our 4 main programs and talk a little bit about really what gives us what drives our programs and also the experience that we have. So first things first, Health Tech Academy is approved by the Texas Workforce Commission, which means we are considered a career school in the state of Texas. With that, we have partnered with several certification agencies to make sure that we provide not only the foundational knowledge and skills that students need to enter the allied health professions that we offer, but also that you're eligible to actually get certified with a nationwide industry recognized certification. So I'm going to start with our clinical medical assistant program. Just a little bit of background about what do medical assistants do. So if you are, considering various different programs, I'm going to just give a broad overview and then talk a little bit about how we're addressing those needs. So a clinical medical assistant is going to be the people that are assisting the physicians in what we call ambulatory or clinical care setting. So these are going to be your outpatient, primary care providers, specialists, OBGYN, really anytime you go to see a doctor in an office. Typically, you're going to have a medical assistant who's going to, take you into the room, provide that patient experience, check your vitals, ask all the, the questions and screening the patients so that they can prepare either the nurse practitioner or the physician, whatever providers in the clinic, to provide treatment and or diagnostic procedures and things like that. The medical assistant really is the most impactful person of a patient experience in that ambulatory care setting, because they're the ones that are going to be doing not only the communicating to the physician, but also the coaching after the fact. So really making sure that the patient understands what they're going to do. You may be asked to draw blood, to do laboratory tests, administer medications. The scope of practice definitely limits some of the things that you do, and also, protects the safety of the clinic and the patient. But that's our role here at Health Tech Academy, is to prepare you to fulfill those roles. Something to note, when you complete our clinical medical assistant program, you are then eligible to take the Certified Clinical Medical Assistant, which is known as the CCMA, with NHA. So our certification for a medical assistant, again, it's nationally recognized. There are some state by state requirements, so we always recommend checking with your state to make sure. But as far as the certification itself, it is approved in all 50 states. And we work with some of the largest employers to ensure that your program is meeting the needs of their medical assisting roles and responsibilities. Any questions on the medical assistant program, or Shamsah, anything else that you would like to add?
Thank you so much, Suzanne. No, that was a great comprehensive view. I did look at the Q&A section and I don't see any questions at this time.
Awesome. Something to note, and this is the case for all of our programs. So as you are exploring what program you want to do with Health Tech Academy, it's important to note that all of our programs are considered self-paced. What that means is there is not a specific start or end date. It really is going to vary based on your dynamic of how much time you can commit to school. If you're able to commit anywhere from 8 to 10 hours a week, which is pretty doable, even if you're working a full-time job, we expect that you're able to complete the program within about 16 weeks. So think about 4 months. Once you complete our program, as long as you pass all of the coursework, you will then be eligible to take the certification. The certification is covered in the cost of the program with Health Tech Academy, as is the certification exam prep. So what does that mean? We can talk a lot more about this in a future webinar, but just know that we put into place a standard to really set you up for success. I've worked in certification for years. I know, on average, we're looking at 75% pass rates. But if we put into place the preparation coursework and expectations, that our pass rates are upwards of 95 to 99%. So that's our goal here, right? Is to set you up for success, not only in the for your certification, but then also for your job. And we do that by really setting some standards and providing you with the resources to feel prepared to take those certification exams. The next role I want to talk about is patient care technician. So a lot of people are, unsure what the difference between a medical assistant and a patient care technician is. And really the biggest difference is medical assistants, think of that, clinical-based assistant to the physician in outpatient care settings. A patient care technician is really the assistant in the hospital. Think of surgeries, inpatient experiences, long-term care facilities, nursing homes. They are providing direct patient care, typically under the supervision of a nurse. They're going to be assisting patients with their personal care, checking vitals, making sure that they have what they need, making sure that they're educated on the next steps. They understand why they are where they are and how their care will be provided. The certification here at Health Tech Academy that we're utilizing for our patient care technician program is the Certified Patient Care Technician certification with the National Health Career Association, also known as NHA. And again, the cost of certification is included in the program, as is the preparation exams specific to the certification. It's important to note that all of our programs are aligned to the competencies of the certifications that we provide. What does that mean, right? Each of these certifications, when you go to take the exam, provide a test plan. And we make sure that the content and the curriculum that we are providing here aligns to the test plan and that is going to prepare you for that. There are going to be multiple checks throughout the program to ensure your competencies and assessments are up to par in order to pass those certification exams. But it's important to note that these are accredited certifications provided by certification agencies, and that they, again, industry recognized and nationwide. Any questions or comments about a patient care technician or the program that we provide? Next, we can do a little shift from general patient care to our dental assisting. Most of you, this is going to be common sense. A dental assistant is somebody who is assisting the dentist in a dental office, right? So not hospital-based and specific to a dental clinic. Something to note about dental assistants is there is a little bit of a difference in the sense that, there's a lot of people who confuse dental hygienists to dental assistants. Dental hygienists are the ones that are actually cleaning your teeth for your routine checkups, right? The dental assistant is the right-hand man or female, man or woman, to a dentist. So when you go in to have, let's say, procedures or surgery or any additional exams that is, not necessarily the dental hygienist cleaning, the dental assistant is going to be the person sitting next to the dentist, helping them with surgical instruments, making sure that the medications or, nitrous oxide, anything that's being delivered is delivered safely. In addition to that, they will often check in the patient, clean up the patient, educate the patient on their way out. So they really, again, first person that a patient sees, they genuinely are assisting the patient through the entire appointment and really make an impact on that patient experience. What's really important to note, similar to some of our other professions, a lot of dental offices, or even when we're talking medical assistants, medical offices, a lot of them are hiring people without any sort of experience. Sometimes the certification isn't even required, right? So why is it necessary to go through a program? And this is the one thing I want to, to address. As a patient, I think we all can agree it would be really nice to know that the person who is that right-hand person in our care, to the dentist, to the provider, whoever they're working for, does have those foundational skills and competencies, understands the risks and the experience of the care that we're getting, and making sure that they have passed a nationwide certification exam, because they have taken those required steps to really get trained and competent on the skills that are necessary. The certification that we provide for our dental assistant students is the Registered Dental Assisting Exam with AMT, which is an American Medical Technologist agency. Again, accredited by the National Certification Agency for all healthcare certifications. So nationwide certification. There are some minor setbacks as far as state by state, so please make sure that you do check with your local state to see if there's any additional requirements. But most importantly, we are providing a virtual experience to get those foundational skills and get you certified so that you can go to a dental office, not only feel confident in the work you're doing, but provide safe patient care. The other thing is there's a lot of places that while they will hire anybody as a kind of a dental assistant in training, for example, they will provide additional pay if you are certified. One really great example is there's a major healthcare system in Indiana. We're going to just talk about patient care tech and medical assistants. They will hire somebody that's not certified, that doesn't have any experience. But if somebody is, their pay is actually $2 to $3 more an hour, easily made up in the cost of the program, and you start making that money from the get-go versus having to wait a year or even two in order to bump yourself up to those additional pay raises. So this is where our programs really are going to give you a step up on a lot of other applicants and students, and provide you with those competencies and certifications necessary to be successful in the industry. Any questions on dental assisting? Great. The final program we're going to talk about today is the pharmacy technician certification. Pharmacy technician program. Certification we do use for the pharmacy technician program is the CPHT with NHA. And the exam itself is called the accepted. So if you see those two things, the CPHT is actually the certification that you get once passing the exam. The exam is called the EXCPT. And that is, again, nationally recognized with NHA, which is an accredited certification agency. Pharmacy technicians, again, most of you probably know this, but pharmacy technicians are the people that work behind the counter at the pharmacy and intake patient prescriptions, enter those prescriptions into the system, work with insurances to make sure that the insurance company is notified and approved before processing those, and then also doing the last check before they give it to the patient. Something to note is that the pharmacy techs themselves are not the ones that are actually counting or delivering the meds, but they are a critical piece in that experience because they're intaking all of the information, making sure that the patient is, fully aware of what they're getting and why they're getting it. And typically the first and the last person that helps the patient when they're getting those prescriptions. They do work hand in hand with the pharmacist. Typically, you're going to see one, maybe two pharmacists in a pharmacy and multiple different pharmacy technicians helping patients getting the drugs and making sure that everything is billed appropriately. Along with one of the biggest challenges when we look at all of these different allied health roles is there is such a need for these roles across the country. I recently looked in one healthcare system in the state of Illinois. They had 120 patient care tech openings. They had 62 pharmacy technicians open. So the good news is none of these programs are going to put you in a position that you're not going to be able to find a job. There are lots of jobs available. What our goal is to set you up for success so that you're one of the top candidates with the qualified certifications to get those roles and come with the experience. As we start talking about Health Tech Academy, the student experience, I just want to review a little bit. I already mentioned that our programs are self-paced. With that said, we all know that the more time you commit, obviously the quicker you'll get done, but also the more relevant the content is going to be. If you wait too long to get through the program, you might lose a little bit of that momentum and experience. So our goal here really is to keep you on track, make sure that you have the tools and the resources necessary to get through the program, and then also find success. Just one moment. For the X-ray, are you talking dental? I just want to make sure. Oh yes, dental assistant. So
Suzanne.
Yeah. We do cover X-ray in the dental assisting program. It does not at this time include the X-ray certification. And there is one reason for that, and that is that every state has a little bit different requirements. Some states don't require it at all, and some states do. With that said, we can coach you on getting that additional X-ray certification. So please, that's something that we can talk one-on-one, but that really is going to depend on the state that you are in. Does that make sense? Okay.
Yes, thank you, Suzanne.
Yep. 1 second. I want to make sure that I'm not cutting out. Job ready. So again, while we want to provide the basic skills and foundational knowledge that you need for the certifications, that's our #1 goal. #2 goal is to make sure that when you come out, you are ready to get a job and that you feel prepared. Sorry, Shamsah, real quick. It looks like I'm pausing. Am I cutting out or is it okay?
Yes, you are cutting out a little bit.
I'm going to turn my camera off just to help. And then 1 sec. Stop sharing my screen for a minute. Sorry, guys. 1 second. Let me just make sure I'm on the right Wi-Fi. Again, if anybody has any questions, please don't hesitate to reach out in the Q&A. Sorry, 1 second. I'm going to switch my Wi-Fi. Okay, I am back. I can't go back on video, but I can share my screen, just making sure. Shamsah, can you tell me you can see my screen now?
Yes, it is loading. Thank you, Suzanne.
So Harry, yes, surgical tech is included. Let's talk a little bit about surgical tech. So something that's really important to note about surgical technician is that that is one that is more heavily regulated state by state. So I highly recommend that you check your state's requirements, but we are partnered and approved by the NCCT. We provide the Tech in Surgery certification, which is recognized across the country. Surgical technicians, if we talk about what that means, so obviously these are going to be people who are involved in surgery. So typically in an operating room surgical center, that can happen in one of 2 ways, right? That can be in a main hospital in their operating room. Even ERs will often have surgical technicians to help assist in surgeries. And then also in independent surgical centers, there's also specialty surgical centers. So there's a lot of different opportunities when we talk about surgical technicians, and you will be eligible to sit for the Tech in Surgery. It's called the TS-C certification with the NCCT. Again, similar experience. We do provide the preparation materials for the surgical tech role, and will include the certification and the cost of the program, as well as additional resources such as videos and practice exams, things like that, to make sure that you are prepared. As we talk about what does it mean to be job ready, right? So we do have coaches on staff. As part of your program, you are required and have the opportunity to meet with people who are in the field, who have actually served in the roles that you are working towards, to really help coach you through the program. This is not meant to just be like a study session, for example. These are meant to really help you align, what does an externship or hands-on experience look like? What do you need to do to prepare for clinicals? It's important to note that while the externship is not required as part of our program, that is very intentional, so that you are able to get certified prior to getting out in the field. But we do highly encourage it. The reality is that most of your learning is going to be online, and that experience of actually having hands-on is going to start connecting the dots. So your mentor and coach will help you through that process. And then we do have a career services team that's going to help you with things like your resume review, or what to prepare for your job interviews. There are additional skills and competencies that are going to be super helpful in addition to the ones that are required for your certification in the industry. And we want to make sure that you feel confident and ready to pursue that in the field. Any questions on any of those aspects of our programs?
I don't see any open questions at this time, Suzanne.
Awesome. Hey, well, from here, I just want to talk a little bit more. So, the one thing I want to be very clear about as well, a lot of our programs are going to be preparing you for those allied health roles and introductions into the industry. There are going to be additional opportunities as you progress in your healthcare career. So just take note that, there are we are working with employers to provide more of a career ladder experience. And what does this mean? So for example, maybe you're a clinical receptionist, you work your way into medical assistant, and then you become an office manager. We're going to have additional courses and programs that are going to help prepare you with healthcare leadership and additional skills that are going to be necessary to make those jumps. And we want to also be very clear that there are going to be, programs that we can offer, but then there's also going to be programs that we're going to refer you and recommend you. For example, if you want to go to nursing school, we want to ensure that you feel prepared and competent to make that next step. And part of that is working with our employers to provide additional opportunities within the systems that our students are working. So really exciting things coming there, but do want to just call out how, where the first to next steps are in each of those various fields. That is all I have for you today as far as information. At this point, would love, if you have any additional questions or would like a follow-up, please enter it in the Q&A. We will have somebody from our team reach out immediately and set up some time to meet with you one-on-one. I'm also happy to answer any additional questions you might have about our programs, what that might look like, the institution, and what your next steps are.
So Suzanne, we do have somebody who would like to who's raised their hand and would like to ask a question from Misty.
Yep, great.
Okay. Misty, please go ahead.
Let us know if you can't go off mute, Misty, or if that was a mistake. Also happens. We all.
Oh, I'm sorry. Hi. I know
Hi.
somebody else asked my question. I just want to know about the clinical part.
Yep.
You didn't really answer the question. So I'm almost done in the program. So I need to know a little bit about the clinical.
Yeah, so it's not required as part of the program. So the goal here is that we get you certified. But if clinicals is something that you're looking to do, we do have some tools for you to help reach out to your local institutions. Which program are you in?
Suzanne, just a minute. I have to enable her again.
That's fine.
Sorry about that, Misty. Please go ahead.
Okay, surgical tech. Thank you, Suzanne.
Yeah, and so my best recommendation is one to look in your area to see what job openings you have. So what does that mean? You can go on Indeed, Career Builder, even LinkedIn, and do a job search to see which facilities in the area have the most surgical technician positions open. Why that matters is it's going to show you really where the needs in your area are. Once you are aware of the open positions that you have, highly recommend calling their HR department and asking them if they provide clinical opportunities for surgical technicians. Typically, they're going to either refer you to what we call a clinical coordinator. Sometimes that's also known as a nurse educator. And you start asking exactly what that needs, what needs to happen for that. The one thing I will say, we are a nationwide organization. We work with students from all 50 states, right? So there might be an employer that we've already been working with in your area, but maybe not, right? Because it's just impossible for us to get everywhere. But Once you do have the information that you need, a lot of times what they're going to ask for is what we call an affiliation agreement or a clinical partnership agreement. That's when we'll step in, and we're more than happy to get that set up for you. The initial work, though, does need to come from you, because we just want to make sure that wherever you are looking to participate in a externship is going to be convenient and realistic and flexible for you and your schedule. And then we can provide any necessary documentation that's required. Does that make sense?
Yeah, thank you.
No, you're great. Yeah. And just know a lot of them will, because it's not required as part of our program, if they're only, let's say they only have availability for, 3 or 4 shifts, that's great. We recommend 120 hours. That's kind of the industry standard across the board. Also helps kind of align with some of the expectations that the healthcare systems set. We do provide clinical skills checklists for each of our programs that is genuinely meant to help guide not only you, but your preceptor through what requirements should be covered. But again, it's not required to finish the program. You can get certified before doing your clinicals, and I highly recommend not putting that off. But the one caveat is what I like to address when we talk about surgical technicians is that you can take the certification exam for any of our programs without clinicals. Surgical technician will require that you have 120 scrubs, but within 2 years of getting your certification. So what does that mean? That means you take the exam and then you get a job, or you go into a clinical experience, and you'll just want to document all 120 scrubs that you have and submit that to the certification agency. To be very clear, that is not a Health Tech Academy requirement. That is an NCCT requirement, and that can happen after you complete the program, after you take the certification exam. It just needs to happen within 2 years of completing the certification exam. So no, rush per se, but just know that that will be a requirement once you start working on the job. Any other questions?
Suzanne, I don't, oh, actually, we did get one more question. And that is, when we schedule our one-on-one for orientation, is it then at that point that we can start our course?
Yes. I will say, yep, I was gonna say, Shamsah, you may know a little bit more, but as far as, yep, you'll have your one-on-one orientation with our student success team. You will then get access to the course as well as the textbook. I do want to address that just really quick though. One of the challenges I think we have in healthcare, especially as we're trying to teach students, right, is that we know nobody wants to read a textbook front to back. We try to include as many other activities and resources and videos and things like that. The one kind of unique experience of a health program versus a lot of other just general studies is that you do have to have a lot of the technical glossary, prescriptions, pharmacology, anatomy, physiology, all of these really technical subjects, right? And those technical subjects have to meet industry standards, which is why you take a certification exam. Because of that, there is going to be a requirement that as you review all of your lessons within the programs, that you are going back and reading additional context in peer-reviewed textbooks. There is nothing that can replace healthcare information, making sure that it's accurate, peer-reviewed, and published professionally. So I just want to be very clear that while we would love to not have anybody read a textbook, it is going to be a requirement, because you will have to pass certification exams that are going to ask those really technical details. And we want to make sure that you have the best information from the best professionals in the industry. With that said, please, please, please use the additional resources that come with your textbooks and within the courses. There are various activities, there's simulation experiences, videos, review questions, all sorts of things to help you kind of ensure that you are understanding the information that you're learning. And then as always, you'll have those coaching sessions throughout the program that you can continue to ask questions. And I encourage everyone that as you're having these coaching sessions, if there is any content or specific part of the program that you don't understand, have your coach give you some examples of how they saw it in the field, right? Let's, for example, if you're in the dental assistant program, ask them when, when we are administering nitrous oxide, what are the things that we have to look for, right? What are some of the risks that are involved? What have you seen happen? What has, or has there been any pushback from your patients? Those are the types of things that like a textbook, lessons, online guides may not provide, but those coaches are going to be a really great resource for you for some of those real life applications and job industry information. Any other questions, or Shamsah, anything else that you can think we need to cover today?
No, I think I don't see any questions. Thank you, Suzanne. I think we covered everything in good detail.
Great. Thank you all so much. We're glad to have you here.
Thank you. Bye-bye.